I'm Scott Miller. This is my life living in Leon, Nicaragua, and we have an exciting announcement that happened this past Sunday on the, I don't even know what day that was, the 21st, I believe. The new super mega hospital in Leon has opened. They had their inauguration. This is the largest medical facility in Central America. This is not a small facility, and importantly, it has major cardiac and oncology units that are based right there. We have not had these things out here in the outlying cities in Nicaragua Occidental previously, and so today we're going to be talking a little bit about healthcare here in Nicaragua right after the bell. Everyone out here in the western side of Nicaragua is super excited about our new mega hospital. We have a few others out here in the region, not super far away. There's lots of new hospitals opening all over the country. We actually have a really dense system of public health care here, and we also have really good private hospitals here as well. We actually make use of several with our family, depending on different things that we're doing. We have a tendency to use Vivian Pellis, which is generally recognized as the best private facility in the country, located on the Messiah Road as you head southeast out of the capital, but also Militar and Bautista are very well known, and there's several other private facilities that are a little bit less expensive generally that are available as well, just in the capital, national level ones, and then different regions have private and public. Additionally, we have a private facility actually just behind the house here as you head up towards Chichigalpa. I'm not right in Chichigalpa, but if you were to go through the fields behind my house, you'd pretty much stumble on a private hospital, a good-sized one, right up there where they can do operations and such. But it's interesting, and maybe it is in conjunction with the hospital opening, but there is a new video that came out on Facebook, so this is shared with me because I don't have Facebook, as many of you know, that Epicast did a video, and I do not know the veracity or the source of this information, but it is interesting that this relatively large Central American podcast show on Facebook has decided to do a breakdown of the top 7 or the ranking of the 7 countries in Central America plus Panama by quality of their healthcare. And just to go through the list really quickly, at number 7, El Salvador, which I actually find pretty surprising that it ranked that low because it is popular as a tourist destination for healthcare. But just because you have good private healthcare doesn't mean you're going to have good public healthcare. At number 6 is Belize. This is not surprising at all. A country that small simply doesn't have the population necessary to have the resources to have a lot of great healthcare. It doesn't mean that what they have is bad. It's a tiny, tiny country. The big hospitals here in Nicaragua each service far more people than there are in Belize in any given region. People are just way too spread out in Belize. If you've ever spent time there, it's barren, right? So Belize generally is going to use Guatemala for resources, and in some cases, Mexico. Now, of course, Mexico is not in the region, so it's not listed in this list. At number 5, Honduras. Not too surprising. We really don't hear a lot about Honduran healthcare. We don't hear about it as a destination. We don't hear about it being super bad, but we never hear, hey, I've got this issue, and I was thinking about going to a Nicaraguan hospital, or maybe I'll just pop over to Honduras. We never hear that. Right, so it just falls out of mind, as it just isn't a place we think of with healthcare. Not because it's bad, and importantly, right, this is a region with pretty decent healthcare, so being low on this list is not necessarily a bad thing. At number 4, Guatemala. I am surprised that they are this low. We do think of Guatemala as a place that we potentially would have to use for some healthcare items simply because it's such a bigger population, and so they have some pretty big medical centers in the capital. But again, we don't think of them as a destination for healthcare. Once you're getting onto a plane, you're really looking at Colombia and Mexico, not Guatemala. So I guess I understand that it's going to be this low, but I'm a little bit surprised by that. I'm actually surprised by how high this one is. At number 3 is Panama. Panama famously has a number of American hospitals that tend to be very, very primary in the country, and that is going to make it very difficult to compete in healthcare. Now, of course, they don't have to stay down at U.S. standards. They can operate at a more regional level. Right, Central America has a much higher level of expected care than you would get in the United States. That's a very real thing. Like, I would avoid healthcare in Panama because I do not trust the institutions that have primacy there, right? Very, very scary facilities in my estimation. And my only experiences with them, right, the very specific ones, not American healthcare in general, I have had absolutely horrific experiences too often with American healthcare. A couple, multiple life-threatening situations caused by hospitals with extremely little track record of care that actually saved me in any way, right? The danger of going to the hospital seems to be higher than the help it may provide. But specifically, one of the ones in Panama, I have, is famous for having complete lunatics on staff in the United States, people you would never trust, given their lack of medical knowledge and basic science, and then our heads of department there. Absolutely unthinkable to go there for medical care, right? Absolutely embarrassing on an international stage, right? When you have a hospital that is internationally embarrassing to your country, you need to really think about going there for medical practice, right? And Panama has one of those. And my only direct experience in Panama with the facilities is I have a friend who did go to both facilities there and both scammed her for care. Right, ran and went to a higher end hospital in Colombia, and they explained the scam. They're like, this is a standard scam from American hospitals. Here's where they're trying to get money from you. Here's what they're telling you. Here's the things. Here's how they're not putting you in medical danger. Here's how they're going to get hundreds of thousands of dollars from you for something that they made up, right? This is all fake. Here's the real thing. And we can, and then was cured in Colombia for like barely anything, right? It was so easy. They had to come up with ways to make money in Panama. So definitely Panama is one that my experience says worry about. At number 2, not surprising at all, Costa Rica always has a great reputation for its healthcare, and it doesn't generally use American healthcare. It has its own healthcare system, but it's known as the Caja, and it's costly. In comparison, everything we hear about it, having not experienced it firsthand, we hear that it is very good, but you have a much more expensive system and you have to pay into it. At number 1, not surprising. So I worry about confirmation bias here. Of course, I want this to be true. So I don't know, again, I don't know where this list originated from. I don't know its veracity or quality, but it's honestly not surprising. Nicaragua is rocking it when it comes to healthcare. Yeah, on the international stage, people don't think of it that much, but when you're actually here and using the system, it is seriously impressive, both private and public. Everything that we have experienced over the years, over minor incidents to major ones, from cost to quality of care, everything consistently points to Nicaragua being one of the best healthcare systems we've ever interacted with. We've had great experiences in Spain and France, Italy, Greece, probably in Romania that I don't remember. We've had medical but not hospital experience in Ukraine, all very good, right? Never had to use a hospital in Panama. But very glad that we didn't. I'm sure it would be fine for minor things, but for major things, I would want to be here in Nicaragua. But our experiences here in Nicaragua are so significant. So this is so good that we're always specifically thankful for the healthcare system here. It really does shine. And simple things like doctors saying, oh, no, we shouldn't just treat symptoms. We need to figure out why this is wrong. This is a regular thing. My wife has a heart condition, right? This just came up this week. And in Mexico, when she was originally diagnosed with it, her doctor said, well, we don't need to know why right now. We got to get you cured. Then, why is a later thing. When she went to the United States, where we lived, the doctors were like, why? We don't need to know why. Doesn't matter. Here in Nicaragua, they're like, we absolutely need to know why, because we may be able to fix this. The U.S. was, we don't know, but hiding this, right? And in so many interactions with doctors here, we have here's what happened in the U.S. And like, we would arrest the doctor for that. That's malpractice, right? This is intentionally putting you at risk. This is, violating basic medical practices. This is, all kinds of things. And so much of it comes down to caring, not being driven by profits, and really follow through and actually caring about the customer, or the patient, right? Whether they're really asking you questions, they're really trying to figure out what's wrong. They're not just treating symptoms. They're trying to fix you. They want to get you healthy. It's so different when it's being treated as a medical thing and not as a business. It is a world of difference, and I'm sure many of these other countries like Costa Rica have similar systems and treatment and hold their doctors to similar standards. But one of the benefits here in Nicaragua is that the public system is free. If you're having emergency care, you don't have to worry about paying even as a tourist. They don't have mechanisms for billing you. Like, that is such a surprising thing. And even private care is so affordable. Knowing that your care can be afforded is pretty critical to going out and actually feeling that you can get that care. Being willing to pursue it, not being stressed and sick while doing so, and so forth. And so certainly if you have to live off of purely free public healthcare, it is less desirable. The system is less comfortable, but the actual medical care that you receive is so often so good. So we're really proud. I hope this list is true. I mean, it makes me feel good to feel this list is true, but our experiences here really do mirror that. And a lot of people, also, everyone we talk to about their experiences here all say the same thing. They are so thankful for the treatment, the quality of care, the way that things happen in Nicaragua. It's been a fantastic experience. So glad to see it being recognized. Excited about the new facility in León. Also, speaking of new facilities in León, we have the new highway, the Pista de los Héroes de la Insurrección, the main kind of cross capital superhighway now that cuts through Managua. It was the old Pope John Paul II, has been upgraded significantly. This has been going on for several years. We now have overpasses through the city. The release of the new highway, the opening of the new highway is so significant. They've had to have constant police presence out there to ticket people for just doing crazy lane things. It's the first time we've had a 10-lane highway in the country, so no one knows how to drive on it. There's new elevated bus stops along the way. They're kind of like tram stations, but it's for buses. They've been posting, the government's been putting out photos of the roads with arrows on all the lanes explaining where you go and what you do in different situations, because the average driver has never seen a road so large before. So it's really interesting to see something like this opening. You can imagine if the U.S. was to suddenly put in a 20-lane highway in, Chicago, suddenly you'd be like, okay, everybody, we're opening this new road. Here's how you have to drive, right? Don't freak out. So that's a big deal, because it's been years of work. It's really disrupted the capital, because they had to shut down the middle of the city to be able to do this. And so much of our time here, so much of my time driving in the capital has been working around this road being closed. Now, I have driven the road in the past. I know it from before it was closed, but it's been a while, so it really affects people coming from, especially León, and going to the airport, because multiple ways across the city use that heavily, and also people who are coming in on the public transportation, on the UCA. That has been, or the Interlocales as it's officially called, that has been working around the construction for quite some time. So they've been going through weird little neighborhoods. They've been taking extra time to get places, so that's going to shave probably only 5 minutes off of the trip between Managua and León. But considering all of the people who, a bus goes one direction or the other every 15 minutes all day long, 7 days a week between those two cities, plus any traffic going to Chinandega, every one of them is getting 5 minutes shaved off throughout the day. And so that's a little bit easier. That's a lot of time when you add up all those people over all those days every week. So it's going to make Managua much more accessible. It's going to ease traffic congestion dramatically on the Suburbana and on the Jean Paul Genis and on the Northway, because this is the biggest road, right? So this can take all those other roads. The Suburbana never gets bigger than occasionally 6 lanes. Almost always 4 lanes, sometimes 2 lanes, right? The Jean Paul Genis is almost always 2 or 4 lanes. The Northway is normally 4 lanes, can hit 6, but for a 10 lane to go through the middle of the city, the heart of all of those. And for those who are wondering, it is one main highway north of the Suburbana, so it really does potentially offload a lot of traffic from that, and is the one that goes nearest to the airport. So the impact is real. In Managua, a lot of people on my live stream talk about it quite a bit. There's a lot of interest about that because it does affect a lot of things. So it's just great to see amazing projects like these coming to fruition here in Nicaragua and seeing recognition for all the great things that are going on. So thanks for joining me. Like and subscribe if you'd like to help support the channel. You can buy me a coffee at buymeacoffee.com/ScottAlMiller. If you have any comments or questions, get in the comments and say hello if nothing else. Check the show notes for information on how you can send in a video of yourself, how to join us on social media, how to do all kinds of things, right? Just get in there and check it out. Also, we have a GoFundMe for my producer Marcela to help raise money. She is a single mother going through the Nicaragua health system, which is free, so she's not paying for her health care, but she does have to pay to take care of her 2 children. She's a single mother, and a lot of struggles, of course, fighting stage 4 Hodgkin's lymphoma since last July, so she's now on 15 months of going through it. Treatments are going well. She's completed her last radiation treatment, and hopefully soon we'll be in Costa Rica getting some testing done. And hopefully things are going well for her. We've been trying to support her throughout this process, so we really are thankful to everyone who has given and shown her support, of course, and just anything you need is in the show notes. If you would take the time to watch another video, it does a lot to help the show, and I will see all of you tomorrow.